Samantha Seitter. I'm a surgical oncology fellow at Moffitt. I'm here at SSO in Phoenix, and I'm going to talk you through our work, which is subtitled Praising the Role of Laparoscopy for Peritoneal Surface Malignancy, a retrospective cohort study. So we know that cytoreductive surgery and hyperthermic intraperitoneal chemotherapy, or CRS HIPEC, can improve long-term survival in patients with peritoneal surface malignancies. And we also know that the peritoneal cancer index, or PCI, scores tumor distribution and size and overall estimates burden of disease. We use staging laparoscopy as an opportunity to provide for PCI assessment, and this guides eligibility for these patients for CRS HIPEC. We also know that staging laparoscopy is limited in its extent to full exploration. So we chose to evaluate PCI scores of patients during staging laparoscopy and then subsequent CRS HIPEC. We did a retrospective review of our patient cohort over about an 8-year period at Moffitt. And then as you can see here, this is our patient cohort. We had 118 patients that had both procedures, 50% male, female, and the median age was 58 years old. Most patients at 43% had appendiceal cancers, and 41% had colon. Smaller numbers, 6% had gastric, and then small bowel and mesothelioma was 3%. We found that across all histologies, the median PCI at staging laparoscopy was 6, and then subsequently at CRS HIPEC was 15. So a median change of 7 points, which is pretty significant for these patients. The most common anatomical sites that experienced a PCI increase were the right flank and the lower ilium. 50% of patients who underwent CRS HIPEC had this aborted due to extensive disease, and small bowel disease was the most common limiting factor. As expected, there was a change in overall survival, benefiting patients who were able to undergo CRS HIPEC in our review. So in summary, staging laparoscopy underestimates PCI by a median of 7 points, with the right flank and the terminal ilium being the most common sites that are underestimates. While this underestimation of PCI doesn't necessarily affect overall survival in these patients, this data point is really important in guiding treatment and decision making with our patients to give them the best care.